now going to transition over to our next lecture. So please join us in welcoming Dr. Mark Kriebel, who will be talking with us about case presentation and knowledge from an ortho intern's perspective. Mark Kriebel is a PGY1 at Ohio Health Doctors Hospital. He completed medical school at Marian University College of Osteopathic Medicine and attended undergrad at Washington State University. He plans to serve as an orthopedic surgeon in the U.S. Air Force. I'll pass it on to Mark now.
Hello, can everybody hear me? Cool. I'm doing this from my phone, so a little bit different of a technical ability here. Thank you for having me again. I'm Mark Kriebel. I'm one of the PGY1s at Doctors Hospital in Columbus, Ohio. Mainly going to be going over kind of prepping for auditions as well as some case prep to think about while you're on auditions and kind of how I did it last year. So you can go ahead in the next slide. So, going to go over my recommended resources as well as some audition prep and advice, kind of a step-by-step process on how you can prep for a case, and then kind of some common classification schemes that you guys will probably run into on an audition trail. So, resources here, the big one is going to be Pocket Pimped. It's a great small resource for auditioning med students. It's basically a collection of 1,500 high yield questions that you'll probably find yourself being asked on your audition trail. They also have a YouTube channel with some short videos that you can access by just typing in the same name. The next one is OrthoBullets. OrthoBullets is a large collective of kind of all things orthopedics. You use it all throughout your time during residency. It's high yield on all topics on orthopedics. It's got your epidemiology, your physical exam, imaging that you should get on any specific injury that you'll see, as well as your indications for surgery versus not surgery principles. It can be a little overwhelming when trying to review, what should I read on OrthoBullets. Kind of getting a big picture overview of the topic is great, and they've got some highlights in blue in their text, kind of important details. And then they'll have, certain topics or statements that on there that have a question mark on the side of it, and that's kind of something that's either been high yield on our in training exams or that is a reference questions on our website. Netter's Concise Orthopedic Anatomy was a great resource when I auditioned. It's a book probably about yay big. You can fit it in your scrubs if you got big pockets. It's probably about 40 or $50. But it's really good about going through each anatomical area and kind of high yield pertaining to orthopedics. And then there'll also be some tidbits on different classification schemes or surgical indications on there too. So it's great to have to be able to flip through quickly. It was highlighted on earlier, but AO Surgery Reference is a great resource for auditioning purposes. It has a kind of picture on trauma, and it's got head to toe anatomical locations that you can click on a specific area and choose, let's say femoral neck fractures, and then it breaks it down to simple or complex, and then you can click that, and it can break it down into whether you're going to treat it with an X-fix or an open reduction internal fixation or a arthroplasty, and then from there it can break it down into the approaches that are used. So it's a really good resource for that. Student to Stud is a YouTube channel that I used while I auditioned. It kind of gives high yield information, kind of what these previous talks were about in terms of different plates and screw basics, x-rays, how to be an orthopedic auditioner, and then it has common trauma injuries and those fractures and kind of how they're treated and why. So it's, quick videos, probably 15, 20 minutes. There's probably less than 25 videos, but it's a good thing to use kind of leading up to auditions. The hip and knee book is kind of a high yield overview of all things arthroplasty when it comes to the hip and knee. It's got the, basic anatomic alignment and stuff like that, as well as implant design, which can kind of help dig you deeper into arthroplasty. OTA lecture slides, their core curriculum. You can go on and view those for free and download them as PDFs. They're really great for like a specific injury. Like let's say there's a big pilon fracture that that is coming up, or you saw one that you kind of want to read more on. They have great lecture slides going through kind of all things for that injury. And then if you are interested in podcasts or you like listening to stuff on your drives or while you're at the gym or something like that, Nailed It Ortho is a good one. OTA has a podcast, and then Ortho Bullets has a podcast that they update daily. And then ViewMedi is a resource. You can create a free account, and essentially you can search videos for different surgical procedures that you're able to view. Um, and some of them are of different qualities depending on who presented the video, but you kind of have to find one that is specifically what you're looking for. So you may have to click through a couple, but they're a great resource for looking at approaches, or if there's a surgery you've never seen before. Excuse me. Sometimes there'll be like a full hip nail and the step-by-step procedures on how it's done. Next slide. So these were kind of goals I had for myself about getting done with third year before fourth year auditions was pocket pimped, getting familiar with that. There's 1,500 questions to kind of master. So I would space them out. You can start early. And then I went over kind of the top 15 high yield ortho bullets for trauma. If you go onto Ortho Bullets, there's a topic section on the left, and when you click trauma, there's a drop down tab that you can click, and it's high yield. Essentially, that's the most frequently asked questions. So I went through the 15 highest ones to get kind of familiarized with those before I started my auditions. It's a good time to start obtaining letters of recommendations from whether it's surgeons you've worked with at your home institutions, or early in your audition trail, maybe the first or second one, starting to look at getting letters of rec from them, and getting your research project nailed down. But at the end of the day, you guys are all still medical students, and you want to do well on your boards. So it's really tempting to get fully submerged in orthopedics when getting ready for your auditions. But just word of the wise, you still have to do well in your step 2 and level 2 exams. So keep studying up on that material and don't put that on the back burner. So audition advice in general, you can, do your research on the programs and how you can apply to audition rotations. Some use vSLO, some don't. In the DO world, most DO programs don't use vSLO. I know my program does use vSLO, but we're one of the only like predominantly DO programs that uses vSLO. Try to be organized, getting your dates planned out accordingly, and making sure you're checking boxes with your individual schools. Some, med schools only let you do 3 auditions or only let you do 4. So just making sure that you know kind of what your school is allowing you to do, because at the end of the day, you still have to graduate from medical school. So make sure you're getting all your core curriculum stuff down. And then think about where the program is located, in terms of, is it a place that you would want to live at for, potentially the next 5 years? Um, you can, reach out to current residents at the program if you have the opportunity to reach out to one of the faculty members and see if they have research projects or residents, or just ask people from your school who have matched into orthopedics if they have any advice about, particular programs. The next slide. So some general principles, it is difficult to go on auditions. It's a stressful time. So just making sure that that it's essentially a month-long job interview. So you want to be showing the best version of yourself. So arriving early, staying late, making sure the job's getting done, working hard, not complaining. Don't be too comfortable. It's easy to start, feeling like you're getting a good relationship with residents and attendings, but just know that it's always a time to be professional because it's always an evaluation. Be kind to everybody you meet. No matter how well you're being treated, you can always, talk to residents about, certain particular things that have happened. And, a lot of the times I know that if something's ever come up with a student and somebody else who's treated them unfairly, just making sure that I'm debriefing with them so that they know, not to take it personally and, keep moving forward. Um, just a little plug, there is a student to stud video on how to act like an orthopedic surgery resident, essentially, which is a good little video to kind of prep yourself. Being a good teammate and helping, the others around you. This is not a competition with other auditioners. I know that that is a tempting thing to look at, but really we're trying to find people who are good at working together. So making sure you're helping everybody and being present in that moment. So some kind of do's and don'ts, prep for cases. Um, if you miss a question, maybe it's a niche topic you didn't know about, read up on it when you go home and you're ready for the next day. That's a big thing, is showing that you're trying to, make up for lacks of knowledge, and being ready for the next day or the next case. Being proactive and helpful, helping setting up splint material. It's tough when you first start because you may have never seen a splint be put on or how to roll out a splint. But as you progress through, more and more auditions or more and more weeks at the same location, and where split material is at, trying to just think ahead and start gathering supplies and stuff like that. If you have access to an EMR, or depending on your audition, if they give you access, pulling up imaging in the room, either before a reduction or before a case, is super helpful. You can always take time to improve your surgery or suturing skills, like palming a needle driver. When I was on my audition trail, I had a needle driver in my car. So basically, every time I drove to a location, I was just opening it and closing it in my car. Some simple suture techniques that you can improve on if you have a suture pad. If you don't have one, you can get one on Amazon for like 15 or 20 bucks. But, just simple interrupted horizontal vertical mattresses, the subcutaneous 2O suturing, and then improving on hand tying. ViewMedi is a good source, or YouTube, to find techniques to hand tie. Everybody has different learning strategies for hand tying and different ways that they learn it. So just find a video that works for you and your hands, and keep practicing it. And then ask questions about the program, show general or genuine interest in the program, and seeing if you could find yourself being a part of that for the next 5 years. Don'ts. So be annoying. It's a vague statement, but essentially having situational awareness is more of the driving factor there. Knowing when is an appropriate time to ask a question, or knowing when is an appropriate time to step in and help move a patient or something along those lines. Making excuses, take ownership for things that went well or things that didn't went well, and try to keep improving. One upping another or a resident on service, whether it's in front of a patient or in front of an attending, is something to try to avoid. There's always time, either the next day or after a certain situation, where you can ask a resident a clarifying question why, they did or didn't do something. And then just to reiterate, being, overly bossy or competitive with another auditioner is something to try to avoid. So here's how I case prepped from an auditioning standpoint. I would look up imaging if it was available, if it was a fracture case or a trauma case for the next day, or a joints case or something like that. Uh, excuse me. If you don't have um, remote EMR access, it's a good idea to try to take pictures of the imaging so that you can look at them later at home. I always started with ortho bullets, read the page on that topic, and make sure I was familiar with kind of the high yield stuff, especially surgical indications, or in a fracture standpoint, like let's say a distal radius, like what your non-op tolerances would be, because that is likely something that they can ask you on. If it's a joints case, you can do a quick review of the hip and knee book for things you maybe haven't learned before. For example, like mechanical versus anatomical alignment, or the different implant types for like total hips, for example. AO surgery reference is great for approaches. Orthobullet's technique side of their website has approaches, but sometimes AO can be a little bit more concise and a little bit more digestible. So that was typically where I started. Netter's anatomy, just to review high yield anatomy in that area. I would review Pocket Pimped if I had time, to go over kind of those quick things that they could ask you, and then also ViewMedi. Next slide. Um, this is some common classifications that are going to be asked about during your audition trail. Um, this is kind of a head down. This is not all of them. I won't bore you and read them all, but the big thing here is what makes a good classification scheme is something that dictates management. So this is going to be like, for example, your femoral neck, like a Garden classification, like your 1 and 2 versus your 3 and 4 can dictate kind of whether you're going to treat something with a ORIF, or whether you're going to need to treat something with a actual joint replacement. Another thing, I didn't have it on that last slide about case prep, but one thing you can do if it's a type of surgery you've never seen before, like let's say a femoral neck system for a hip fracture, you can Google the technique guides for a lot of these implants, and they'll just pull up, and you can kind of look through, and it'll tell you the step-by-step steps of how that implant is used. Um, and I actually I got pimped while I was on an audition on the angle of the FNS guide, and I had read the implant guide and knew that it was 130 degrees. So it got me some points with that one resident that asked me that. So it's just another thing you can use if you feel comfortable with everything else that you've studied for on that particular case. That's all I got in terms of auditioning and case prep. These are just some images that I've gotten lucky to participate in some surgeries in a skills lab during my intern year. Do you guys have any questions? I know it's a lot to digest. Cool. All right. Well, good luck, everybody.
All right. Thank you, Mark, for that incredible advice. It's very valuable to hear from someone who succeeded in their sub Is and made it through this process. So we really appreciate your wisdom.